Hi. So a few months ago, I was watching a program in which a journalist was interviewing a neurosurgeon. Both of them were Black, and they were discussing different things with regards to health and wellness. And they came upon the topic of dementia and Blacks. And as you know, we Black people have much higher rates of dementia than white people, as much as twice as high. In some places around the world, they say as much as 4 times as high. Anyway, so the question he poses to the neurosurgeon is, or was, why is that so? Why are Blacks have such high risk of having dementia? And the neurosurgeon kind of paused, thought about it for a while. All this time, I stopped everything I was doing. I leaned in intently myself because I was sure to get a few gems of wisdom from this neurosurgeon. But after a while, he just took a big, deep sigh and he said, "We don't know." And I was like, "What? What do you mean you don't know? I mean, how can you be sitting at the top of the food chain, at least where health is concerned and health and medicine are concerned, and you can't even offer some kind of reason?" And the journalist, what on earth are you doing letting him get away with that? Why didn't you press in? Why didn't you ask, well, why not? How about this, and this? The truth of the matter is there are about 7 different reasons. I'll put them as categories of reasons because each reason has several sub-reasons as to why Blacks have higher rates of dementia than whites. The obvious ones are we have higher rates of hypertension and diabetes, cardiovascular disease in general. That's a huge risk factor for dementia. Uncontrolled hypertension, for one, is a huge risk factor. If you're not taking your drugs regularly, if you're not keeping your blood pressure below 120 and 120 over 80, some people give a little more room than that, but 120 over 80, if you're not keeping that level at that stage, you have a higher risk for dementia. And we know that a lot of Black people who are just very careless about their blood pressure. Some of them are on 3, 4. And another problem, obviously, is that there's a challenge getting the right drugs or combination of drugs that will work for them. Because as you probably don't know this, but the drugs that work for white people when it comes to hypertension are very, very different than the ones that work for Black people. In fact, if you give a Black person the drugs that you give a white person, the Black person could get hurt. You could hurt or harm the Black person. So that's a factor on its own. So there's a challenge, especially in developed countries, to find the right combination of drugs that work for hypertension. But that's beside the point. The point is this: we should be taking the charge, especially healthcare professionals who are Black or who have an African heritage or ancestry, should take it upon ourselves to find out and begin to talk to our patients and to our other doctors about these reasons so that we can be proactive enough to check and search for these risk factors so that we can reduce this rate. I don't understand that. When I was watching this thing, I was like, who did this to us? If the roles had been the roles had been different. If both of them were white, would the journalists have let him get away with this? I think not. So again, the point being that we really, really, really need to take it upon ourselves to to be serious about finding out these risk factors. And like I said, there are 7. There are genetic factors, there are illness factors, there are environmental factors, dietary, there are lifestyle factors. I'm going to be talking about these. I'm going to be taking each point and really expounding on that. So stay tuned. God bless. Bye.